welcome to Vivace Dermatology and Wellness Center here at the Cube on Riverside Drive. And we get to the part 2 of this episode dedicated to weight loss treatment. And now we're talking about pills, injectables, and we want to get to know the real tea behind how this works, and of course the safety precautions that you should take if you want to get on this weight loss treatment. So we get to meet Dr. Natasha Odhiambo as well as Glory, who was our clinical nutritionist in part 1 of the show, as we dive deeper into the world of weight loss trends. So let's get into it. Thank you so much, ladies, for having me here. I've really taken over your space, but thank you. So let's get to meet Dr. Natasha. Hi, Dr. Natasha.
Hi, how are you?
Tell us more about yourself.
My name is Dr. Natasha Odhiambo. I'm a medical doctor who works here at Vivace Dermatology and Wellness Center.
Fantastic. So Glory was with us in the first half of the show, but now Dr. Natasha is going to tell us more now as we speak about injectables, right? And we've seen a huge rise of weight loss injectables, yeah? So what exactly do medications like Mounjaro and Ozempic do?
I'll take that question. So these are what we call in medical terms GLP-1 receptor agonists. And to simplify this, it's just medications that mimic your gut hormones. They mimic your gut hormones to regulate your blood sugar and reduce your appetite. How do they do this? By slowing down gastric emptying, which is just basically keeping food in your stomach for longer, increasing insulin sensitivity, and acting on appetite centers in the brain to reduce hunger and increase satiety, meaning you feel fuller for longer.
So how do these medications help with weight loss, and how long does someone have to be on them?
They help basically, in summary, I mean it's a whole medical thing, but in summary they reduce your caloric intake. So because we're keeping you fuller for longer, you're not eating as much, you are slowing down your gastric emptying, so you're basically feeling fuller. And we all know if you reduce your caloric intake, you will lose weight. How long does one need to be on them for? It depends. Because it's a slow and gradual process of weight loss, they've basically termed long-term therapies, and the medication is effective as long as you're on it. So how long will depend on the patient and how much we're looking to lose.
Okay.
Yeah.
And then also when it comes to weight loss injections, we're very keen to insist that in as much as you're on the weight loss medication, if you need sustainability, you need to have discipline when it comes to what you're eating. So overall diet modification is actually required, and also physical activity level, because in as much as it's increasing the level in which your body is burning fat, what happens when you stop taking these injections? Your body goes back to normal. So if we don't have the discipline to actually what am I supposed to eat? How much of this am I supposed to eat? A physical activity level as well, so that you build muscle, so that you don't get the loose skin. So they work hand in hand with diet and exercise as well.
Okay. And there's been a lot of talk about side effects. I mean, just recently I was reading about an Ozempic lawsuit, and you know, side effects like, for example, blindness, things like apparently thyroid causes thyroid cancer. You know, these are things that people are reading, and it can cause a lot of, you know, panic. What are some things that the people watching should be aware of before getting into, you know, such kind of injectables?
I will say that first of all, you have to make sure that you're getting it from a medical professional or a licensed facility. Just because these are medical interventions, you can't get it at your local spa or anything. This is a medication, and with all medications we do get side effects. Okay, so the known side effects or the common side effects are in the gastrointestinal system. So you'll get nausea, vomiting, loose stool, constipation, but this depends patient to patient. Not every patient gets a side effect, but it is something we do warn about. There are also contraindications, and that's why you have to see a medical professional to take in the medication. There are some things that if you do have or are at risk to, you are then not eligible to be on the injection.
Okay.
Yeah.
So we've also seen innovations like the swallowable gastric balloon. Is that the same thing as a Lurion balloon?
Yes. So the swallowable gastric balloon, which is called the Allurion, it's an outpatient procedure. So that means you don't require any surgery, endoscopy, anesthesia before you do the procedure. So it takes 20 to 25 minutes at most. So when you come in, the swallowable capsule is this size. So it's attached to a catheter. So when you come in, you swallow the capsule while it's attached to the catheter. We take an X-ray to make sure it's all situated in your stomach. It's filled with water through the catheter. We take an X-ray to make sure it's full, then the catheter is removed. So it stays in your stomach for 4 months, and you expect to lose at least 10 to 15% of your body weight.
Okay.
Yes.
Wow, and it's guaranteed. Okay. Why do you think people love, for example, like the Allurion? Why do people love it?
Mostly because it's non-invasive. You see, most of the balloons, there is also surgery as well. So when you hear it's non-invasive, that means you don't need to go under. That means also you don't require any downtime, in as much as there are side effects to it. But when it's compared to other weight loss procedures such as the surgeries, this is a much more safer. And if you can still lose the weight and you don't require so much downtime, then why not choose the easier one? In as much as it's not easy, it's just safer.
Yeah.
Yes.
Fantastic.
Yeah.
So,
just to add on what Glory said, in terms of non-invasive, there are other technologies and things such as what we're now calling the endoscopic sleeve gastrectomy, which is for people with a higher BMI, who have a lot more weight to lose. And this is also less invasive. It's done through endoscopy, and it's just a gastrectomy as you would know it. So we're reducing the size of the stomach, but without actually openly cutting you up. So we do this all by endoscopy, suture the stomach, and yeah, get a whole gastrectomy. But the difference is it's endoscopic, so less invasive, done under sedation only. So you come in, get sedated, do your procedure, and you go home.
oh wow.
Yeah. And it's long term, especially for people who want to lose more weight, maybe more. 20, 30, morbidly obese. So this is actually a very good option because it's not surgical as well. It's just endoscopic, and the results are much more sustainable because it's long term. So you lose more weight, safer way as well.
And because you guys are a wellness center, I know you're not just looking at the people coming in to do the treatments and then leaving. What other ways are you guys helping your patients make sure that they have sustainable results? Are there any lifestyle guidances that you guys offer? What are some of the most common things that you tell clients when they come in so that they're able to see better results and for longer?
Okay, so when patients come in for consultations, so number one, it will take you through a nutrition care process. So we take you through a BMI, and then we check your BMI to know maybe if someone is overweight, obese, normal. We also do lab works to check your metabolic profile, to check lipid profile as well, to check your sugar levels, thyroid, just to know your whole psychological being. After that, after we do consultation, we look at your options in terms of weight loss as well. If there's emotional eating, we need to look at also the root cause as well. So we refer to a psychotherapist. We also do dietary modification, where in as much as we've done the balloon, we do follow-ups. So with the Allurion balloon, in as much as it's 4 months, our program is 6 months. So the extra 2 months are for nutrition follow-up to make sure that you follow the same guidelines that you are following with the balloon, and even after, to make sure that you don't gain back the weight. So we also do, we just do a follow-up throughout, even after the balloon comes out. We can still do a follow-up to make sure that there's dietary modification and you're following with your trainer, your health coaches, and your psychotherapists as well, so that there is sustainability.
Yeah.
Yes.
Yeah, just what Glory has said, it's to make sure the patient is aware that it's a multidisciplinary approach. Okay, so I will come in as a doctor and give the medical interventions as needed and help guide you through the process. There's a nutritionist, you, which is Glory, and then the psychotherapist, and you should have a fitness coach and all this. So it's a multidisciplinary team to help you in all aspects of weight loss. And on the medical side, it's also to let the patient know that it's not a shortcut. None of these are shortcuts. Neither the balloon or sleeve, whatever mode you decide to use as a weight loss. It's more a medical intervention to help you get where you need to be, but not a shortcut. You will still need to do the work for it to be sustainable and helpful. You need to do the work. You need to work on suppressing your appetite yourself or disciplining yourself, getting that extra, you know, exercise workout in, watching what you eat, listening to what Glory will tell you about your nutrition. So it's just to make the patient aware that what I will prescribe or whatever I give you will help you, but at the end of the day, it will be up to you to help sustain the weight loss.
Yeah, we normally call it a boost.
Yeah.
So it's not the overall solution, it's just a boost for you, like a kickstart for you.
Okay, so it's very important for everyone to know that there needs to be work, you know, back at home. Once you're out of here, there's more work to be done at home.
Yes.
Especially with the injectables, because regardless of what you do, you will lose weight. It's just how the medication works. So while you're on it, you will see, despite whatever you do, you will see weight loss. But because you might not be on it for life, you need to have developed habits that will help you maintain the weight loss after. So it's very easy to view it as a shortcut while you're on the injectables, but I mean, it'll catch up to you at the end, you know. So it's very important for us, for the patient to know and understand, this is what will happen, this is what we'll do, but you need to actively be trying to modify your life for after.
Okay.
Yeah.
Here's the step that most people often skip, and that is the mouthwash. Now, the mouthwash is not just your freshener. This is your last line of defense. And how do you properly use it? Make sure that you use it after you brush. That is twice daily. So after you brush, that is morning and night, make sure to use your mouthwash. And what does your mouthwash do? Your mouthwash kills any lingering bacteria. It also provides active protection and also just gives your mouth that fresh breath for so many hours. Now, how do you do that? Make sure to use 20 ml of your Colgate Total mouthwash and make sure to put it in your mouth for 30 seconds. And do not eat 30 minutes after using your mouthwash to make sure that you get the full effect. And to even take it a notch higher, use your mouthwash and also use any of the other toothpaste. You could use your mint, you could use your advanced whitening, or you could use your charcoal just for that deep clean. And with that, you get the full package, and that is a brighter smile, full confidence, and 15 times more effective protection against root causes that bring about oral issues. Is there a danger in glamorizing a lot of the solutions, and where should the balance be?
Yes, especially if you look at it as an easy fix. Number one is the question of the cost, consistency, because you see, anything that you're doing, for you to see results, you need to be consistent. But you see, our bodies are different. How long do I need to be on this for me to see results? So that means also you have to consider the cost as well. There is side effects that we also have to consider, and the medical history perspective. So I think it's for us to look at it as an aid, but not just as an overall replacement. Yes, yes.
Yeah. I guess, and to put the onus back on us as health professionals, is also to know the right type of patient to take on, because we live in a digital age. Everyone is has access to information and has access to all these things, especially if you have access to the resources, meaning money. So you have to be very particular on the patient you take on, meaning the indication for the program has to be there. And that's where now the glamorization comes. If you want to lose 5 kilos, I mean, surely you do not need to be on an injectable, you know?
You can just go to the gym.
And
work with a nutritionist
these are medical interventions for people who struggle with obesity, you know, which is now being modified to be a chronic illness, you know. So for a small, you know, I have 2 kgs to lose for a wedding, that's where the glamorization comes in. So for us healthcare professionals is to know the correct criteria for adopting the patient, or knowing which patient to take on and which patient to say, I'm sorry, but I have to turn you down.
Want more than just a clean mouth? Then upgrade to the Colgate Total system. With the toothbrush, the toothpaste, and the mouthwash working together, you get active prevention that protects your entire mouth. And even better, you get to choose the total that fits you. Now, if you want active freshness throughout the entire day, then the Colgate Total Mint is for you, because it delivers 12-hour anti-germ protection, which is great for you, because who wants to smell bad? Not me, so you shouldn't, okay? So if you want a toothpaste that naturally lifts off surface stains, then the Colgate Total Charcoal is for you. It has charcoal microparticles that lifts surface stains, making your teeth look clean. Now, if you want white teeth, so the Colgate Total Advanced Whitening is for you. That's because it is just perfect for your teeth, okay? Whichever you choose, when you use the full Colgate Total system, you're not just brushing, you are getting 15 times more protection against the root causes that come about from oral issues. So today, pick your power. Choose the Colgate Total system. Smile with confidence. I agree. So I guess the buck just stops with the healthcare professionals, because how greedy are you for money? Because I've seen a lot of people online, you look at them and you're just like, man, you could just do a 30-minute jog every day and you'll be fine. But you know, they're on something like, you know, Manjaro, etc. All right. What are some of the trends that you're seeing online that you would say are harmful to really just try them? And what are some that you're seeing that are really beneficial for people? So maybe we can start with the bad stuff that you're seeing online that you feel like people should not really just pay attention to that, and some that are actually good.
One of them is getting medical advice from people on social media, because I feel like everyone has experience. According to social media, everyone has experience, and then you see our bodies are different. What would have worked for you in terms even of 100%. Skincare, weight loss, medication as well. So everyone has their own opinion and advice when it comes to what you should do, what you should not do. Yeah. So for me, I just advise you, make sure you go to a medical professional, licensed as well, so that you get, and then also get a second opinion as well, so that you get the best help that you can.
I think the one thing that I've seen really that I don't recommend is this thing of prolonged fasting. Somebody will be like, I fasted for like 48 hours and I only had water and I've dropped like 2 kgs and I do this every 2 weeks. No, it's not sustainable. It's not good for you.
It's not even realistic. That's where you'll see someone, maybe you're starving yourself to lose weight, but then you end up gaining more weight. Because now, if you starve yourself for like the whole day, now you decide to stop the fast in the morning. When you wake up, you'll be so hungry that you'll end up
when you're just thinking about everything. You're like, oh my gosh,
exactly.
I want cake, I want all the things that you miss and love, you end up binging on them.
Yes.
Yeah. Okay. So what is the future for weight loss as far as tech, innovations go? Because you guys have some really amazing innovations here. What's the future? Are you guys positive and optimistic about the future for weight loss?
I'm very positive. The future is, I mean, we can't predict. Just 3 years ago, we didn't have the injectables. There's a very, very promising future. Everything is, there's a lot of research being done in terms of weight loss, in terms of how to make it not easier, but more sustainable. So the future is very promising, both in terms of pharmacotherapy, meaning medications, and also just body contouring and machinery. There's a lot that's coming into the market, and we're very, very excited about that. Yeah.
I would say yes as well, because technology is really moving fast. So you see, even in terms of hormone therapy, there are drugs that can help you if your body is lacking specific hormones. The scientists are developing different hormones in terms of drug that can work for you. The same to gene therapies as well. So I think we should be very open-minded when it comes to technologies, because the same way 20 years ago we didn't have any body contouring machine. Like, you can just lie on a bed and then you just tone, you lose fat. It was never there. So you see, that means even in a few years to come, more technologies will have developed. So yeah, we're very open to that for sure.
And to add one more thing, I think maybe the best thing that's coming out of it is treatment is becoming more personalized.
Yes.
It's not a one size fits all and, you know, just reduce your calories. I mean, the basis of it is the same, but sometimes causes of weight gain are addressed differently. So we need to tackle it from different angles depending on the patient and the cause of your weight. So I think that's the most promising thing for me, is that it's not just a generalized treatment, one for all, but we're able now slowly and gradually to help personalize the treatment as well.
With the patient's needs.
Fantastic. Thank you so much, ladies. It's been an honor to be here with you guys, and I hope you at home have learned a thing or two. I think we've learned more than a thing or two. There's so much about weight loss online, but like we've learned today, seek medical advice, make sure to, you know, get help from a professional, and remember that it's not just one size fits all. So you too can get help for whatever it is that you're struggling with. So thank you so much for watching the show. From myself and the team here at Vivace Dermatology and Wellness Center, goodbye, and until next Wednesday, mwah, stay glam.
Okay. So the under,
yeah, you can see. So the under, let me just turn.
Okay. What's that?
Sasa tunakat juu ya hii part. So yeah, so lazima nisonge.
So this is the machine. So when you come in, you wear this. Oh, sorry.